Hi, and welcome to Fairview Range Focus. I'm David Hall. Today we're going to talk about hospital chaplaincy, and I have the pleasure of welcoming three of our volunteer chaplains, Terry Tilton, Steve Breitbarth, and Mark Anderson. I know each of them well, and so I'm looking forward to being able to visit and talk about hospital chaplaincy. And it's a newer program for Fairview. Hospital chaplaincy has been around for a few hundred years. But we haven't had it in place for quite that long. So thank you for joining me, gentlemen. Not everybody knows you, and so maybe just as a courtesy to those watching today, just a brief introduction, if you would, to tell us just a little bit about your background or what brought you to hospital chaplaincy. Just a few comments. Terry.
My name is Terry Tilton. I am a United Methodist minister, retired in the past year, currently serving a church in Chisholm, however, in a retired capacity. Chaplaincy has been a part of ministry for 44 years now. So much so that in our theological training and for the Master of Divinity degree, which all of us basically need as a basic degree, clinical pastoral education is required, and almost all pastors will have at least 1 unit or 3 months or 400 hours of direct training in chaplaincy or working out of some chaplaincy situation.
Okay, so it's a lot. Okay. Okay, thank you, Terry. How about you, Steve?
And I'm Steve Breitbarth, former pastor of Grace Lutheran in Chisholm for 35 years, and have been serving as volunteer chaplain in terms of law enforcement for over 15 years, but hospital chaplain. Also had CPE training, as you have, Terry, along with my master's degree.
Okay.
And hospital chaplaincy is just a way to reach out and help people in need, both patients and staff.
Great.
So.
Good. And Mark?
Yes, and I'm Mark Anderson, and I'm associate pastor at Chisholm Baptist Church. And I've had a background just in hospital before coming. I've kind of have a varied background in that I not only went to like Bible school and seminary and things like that, but in business as well. And so I was in a Fairview hospital in Wyoming, Minnesota for 7 years and kind of doing quality work and so on. But I've been in hospital settings and nursing homes and things like that, and just love the fact of coming beside people and encouraging them, and so that's really what's drawn me to chaplaincy, and so I've been at Chisholm Baptist for 6 years in this area, and I've really enjoyed it. So.
Good. Good.
Yeah.
Well, thank you for the intro. I know, as I mentioned earlier, the hospital chaplaincy program that we have at Fairview is newer, so it's going to be newer to, I think, probably to some people too, viewing as far as understanding. So exactly what does a hospital chaplain do? What is the role of a hospital chaplain? Can somebody expound on that for us?
For me, I define it as I'm there to provide emotional and spiritual support for staff and patients. I think people are confused and see so many of us as being territorial, that we're looking for new members. I have to say, being retired and not officially being a pastor of a church, I'm not looking for new members. So,
I think to add to that too, we're really a community connection, a faith connection to the community, and in introducing just the faith background of people in just where they're at. And if they do have a particular background, we can connect them to the faith community at large, and that's just a real positive thing. And if there's no faith background at all, we have the ability just to be there for them. And some may really say, hey, I would love that right now, and some may not, but it shows that we're there for them.
Right. Terry,
in its best sense, chaplaincy is about interfaith ministry. It's actually a form of part of the care team for a hospital.
Okay.
And our work is essentially with spiritual and emotional care. occasionally counseling. Occasionally we will do some sacramental work if asked, but only if another pastor, their pastor or priest is not available. It's an interfaith ministry. It is not an ecumenical ministry. I use those terms very specifically. Ecumenical in the sense of Christian. We are not specifically Christian ministers except to those who are Christian. Our ministry is to any individual who is seeking an awareness or getting in touch with their spiritual power, their spiritual source of strength, and that's our primary focus at all times.
Thanks for sharing that, because that's been my understanding as well, that there's a very non-denominational aspect to this, but it's a non-Christian necessarily as far as you meeting people where they're at,
Right.
whether that be Christian, Muslim, or otherwise.
Native American,
Native American.
Buddhist, we don't. We meet them all, although some not as many as others.
Sure.
in this
Sure.
context.
Yeah, and our geography lends itself, obviously, I think that probably predominantly Christian,
Christian.
by nature, but certainly I think the non-denominational and meeting people where they're at spiritually.
Unfortunately, the vast majority of the people, and I won't say the vast majority, but a majority of people I think that we do meet have no direct affiliation with the church or a spiritual mentor, and maybe that's just part and parcel of our time in society right now, but it seems to be true.
Steve, help us understand. So it's almost somewhat of a liaison between the local church and the hospital, in the sense that, so if somebody comes into the hospital, how can you help them connect to their church if they want to do that? Is that a role that chaplains can fill?
As chaplains, we usually ask if they are a member of a local congregation, and if we can do anything to contact their clergy, whoever that might be. And so, yes, we make that connection. We're
Okay.
not a substitute for the local clergy. We're an addition to local clergy. We're actually an addition to the hospital staff. We're part of the staff itself.
Yeah, absolutely. And I know you've shared it with me many times with regards to providing support, spiritual support for not just our patients and their families, but employees.
Right.
Can you speak to that?
Well, it's my belief that that if an employee is having some personal struggles, not necessarily work related, that can affect affect them on the job. Not that they mess up by any means, but let's face it. Sometimes nurses may not be the most pleasant, and someone might say they're really a Red Cross nurse. Cross meaning someone that's rather upset or whatever, and so that's the way I see it is to be there for staff and to be a shoulder to lean on and a shoulder to cry on, which at times they have.
Okay.
I think
Go ahead,
sorry,
Mark.
but I think making the connections with the nurses and staff, that's building trust between the chaplains and them as well, which builds the whole team together, because we're all in this together as far as providing support for the patients that are there.
Right. Good. Terry?
As chaplains, we do specialize. Steve has some special training in counseling, and has a great deal of interest in working with staff directly. It is not that any of us do not, but some of us specialize in some areas more than others.
Sure.
My involvement tends to be more with the fifth floor in behavioral health,
Okay.
because I have a particular interest in that field. We visit all of our patients to the extent that they either request a visit or they indicate that they wish to have, or that we can determine to what extent spiritual care might be needed or wanted. Obviously, the length of stays makes some difference for the type of contact that we can make. The average stay, I believe, of most of our hospital patients is, 1.7 days or
Less than 2.
Less than 2 days, and behavioral health unit, which is on the 5th floor, those stays are much, much longer.
Right.
I would guess that they're probably much closer to at least a week and a half to 2 weeks. But it's a little bit different type of care that's being given there.
Right.
At times, we will call on patients where staff might feel that it's beneficial for us to speak to them. You know, for example, an individual that has just been told by the doctor that they have a limited life expectancy, you know, a few weeks or months or whatever the case might be, and they're able to share with staff, but I have found that they usually, it takes a different tone when they're speaking to a chaplain.
And I think the staff in general feels that those types of critical emotional and spiritual care needs are maybe more easily handled by those of us that are in the profession.
Sure.
All of us are on call. Any one chaplain of us is on call at any time, day or night, on a rotating basis, and it is not unusual for us to get a telephone call that an individual has come into the emergency room and suddenly passed, or there is a critical situation in delivery, or there simply is a crisis situation based upon some emotional need by a patient, where the staff feels that they need to have some additional support.
And as you mentioned that, several calls that I have responded to, you know, it's not necessarily in some cases the family, but it is the staff that is having
some difficulty.
a difficult time, because part of their training is to preserve life. And when it takes a turn and goes in the opposite direction, that goes against
There's some trauma,
staff
there's
training.
some very significant trauma sometimes that they have to go through, and somehow you have to be able to perform, do the function that you need to do, but that doesn't mean that your heart and mind aren't still actively engaged and sometimes needy.
Okay. Mark, a question for you. I kind of touched on it with regards to the non-denominational aspect and meeting people where they're at from a faith standpoint, wherever that might be. It seems to me, and I just want you to, I guess, expound on it or tell me if I'm right or not, but it seems like sometimes patients almost find sometimes it can be easier to talk to a chaplain than maybe their own minister or at their own church, either because they don't know them that well or just maybe because of the neutral aspect of chaplaincy. Do you find that to be the case, or any truth?
Well, I think that's often true, and you know, sometimes, you know, people may be a member of a church. Maybe they haven't showed up for a long time, and maybe they feel a little bit, you know, who knows? They may feel embarrassed about that, and maybe they're just not sure where they are at, just physically, and what they've heard, and they've heard news. But you know, as a chaplain, they know, here's, like you said, here's more of a neutral person. They have an interest in faith, and they have an interest in listening to me. And that's the part I really enjoy about chaplaincy, is that just that one-on-one, and creating a calmness, a hopefulness, and really letting them lead as far as, you know, where they're at right now. And many times that can move into areas of spirituality where they're at, and sometimes they say, I would like prayer, if you know, they'll ask for it, which again, I've left many rooms with people, you know, just feeling much more at calm, ease, or a sense of peacefulness, which I think that's what a chaplain also is for, is to give them that both emotional, spiritual support.
Right.
And I think at least it seems to me at times people see us as having a different level of confidentiality that kind of goes beyond the staff. You know, the staff certainly is bound by confidentiality, but just being part of the religious community or clergy.
Yeah, sometimes I think, and to piggyback on what Mark said, I think the chaplains sometimes are available when either a pastor or priest may not be as readily available and they're in the midst of some crisis. And so we are a readily available listening ear at the moment, which seems significant for that individual. And you know, if we stay 5 minutes, if we stay an hour, it makes no difference in our capacity. It is to the extent that we have been able to provide some support for that individual, whatever that might be.
And before what you said, Terry, was that, you know, there are many that they don't affiliate with any particular religious background at the current time at all, and yet they are requesting a chaplain to come and visit them, which you know tells you that they have there's something there, you know, as far as their spiritual background or life or something that is beyond them that they would like to get in touch with at a crucial time where they feel in their life that, you know, things are really maybe confusing or maybe my life is in danger or something, and that we can just help support them at that time.
I think, you know, we so often have been talking in terms of referrals, but, you know, we also call on individuals if they've been admitted that day, the new admits, and even though they didn't request a visit from the chaplain, you know, my philosophy is I always know where the door is at, but I've stopped in many times and they, even though they didn't request a chaplain, oh, so glad you're here, you know.
Glad to have a prayer with you, or got something on their mind that they feel that they'd like to share. I think chaplaincy recognizes, I think, that the whole person is body, mind, and spirit, and that whether we choose to recognize it or not, there's a spiritual element to our lives. If nothing else, asking ultimate questions. There are points in which they become much more ultimate, sometimes often in a hospital setting, so it gives us an opportunity to explore some of that with them. We can only point them at sources, or to hopefully to either reacquaint them with the sources of strength that they have had, or to say, here are places where we think you might be able to gain some strength. We cannot minister on an ongoing basis out of a hospital setting. It's not our ministry to say that somehow we have an individual that we can work with for the next week, month, or year. It doesn't happen that way. Occasionally we do see an individual that comes back in, obviously. But for the most part, our ministry is based upon immediate needs and then trying to help people get in touch with what their need is today.
Right. So often it seems like when patients are coming into the hospital, it is somewhat can be a vulnerable moments where they're either questioning their life or concerned about
questioning
longevity.
The staff or the setting
Sure.
or the procedures. I mean, we get all kinds of questions, and to some extent we're a neutral, to many people they perceive us as a neutral third party in that process.
Right, important part, right.
Yeah.
Terry, you mentioned about behavioral health and that you have a special interest, passion for that. Can you talk to us about what do you do there?
Well, the chaplain makes himself available, but more than that, I have a group setting. Just as in behavioral health, there are a number of groups that are held during each day, often based on life skill issues. My setting is obviously one related to what are some of the spiritual issues that you're dealing with or you would like to discuss. I do not have a set agenda. That doesn't mean that we don't come around sometimes to some themes that seem to be common. But the individuals that are there on the 5th floor often are coming because of a dependency or a medical crisis based upon not taking medications, a psychosis or a particular mental illness that's affecting their life, and unfortunately not just their life, but the members of their family. And they often leave loved ones behind. Sometimes they are pulled out of society by a court order to get services and help. There are many different situations that we're dealing with, but these people, for the most part, I find particularly needy. I I think probably because they have been oftentimes through some rehab or 12-step program or some other program, they have been acquainted with spirituality and have been asked, how will this help you? And should I get in touch with that again? And to that extent, then we help to hopefully maybe guide that, encourage that, pick them up wherever they're at. We have individuals, virtually every religious and denominational background, some that are none, and yet they have a spirituality. They can't name it, but they have it. And so I find it, you never know what you're going to walk into from one day to the next. I find that interesting and challenging.
Yeah. And then maybe, Steve, you can speak to it. There's also a respect to individuals, no matter what their faith is, even if that means there's no faith, that they're agnostic. Is that right?
That's right. We take them where they're at. Is a phrase that I learned many years ago is when someone is drowning, that's not the time to try to teach them how to swim. We take people where they're at.
We have to be absolutely non-judgmental.
That's right.
That's right. We do not come with a preconceived agenda when we walk into a room.
Okay. Which again, I think to me is one of the strengths of chaplaincy, and probably a bit of the welcoming that you receive, because there isn't a judgmental.
Right. As a matter of fact, even in terms of in leaving the room, I will ask, would you like me to pray with you, giving them the option. And sometimes they will say no.
Sometimes they will, and sometimes they won't.
And sometimes I even jokingly say, would you like me to pray with you? And depending on how the conversation has been, I say, well, that's part of my job to be. I wouldn't be doing my job if I didn't ask that.
But the other part of that is, what can we do to help you? And
Right.
sometimes prayer is immediate and is asked for. Other times, getting in touch with family, sometimes getting in touch with the pastor or priest. At other times, just the assurance that whatever this crisis is, it isn't maybe quite as, it's being contained, and maybe we can live through it. And to have that kind of strength to be able to live through that crisis, and in good measure, that's a part of the counseling skill that we do. Counseling is helping people to see possibilities where they could not see them before. And if we can do that, often it gives hope. It gives some sense of assurance that I can get through this.
Right. I know we work closely with Fairview Spiritual Health Services in the Twin Cities, and they've come up and done some training with each of you participated in. But you mentioned CPE, and Steve, I wonder if you could tell us what is that, and what does that mean as far as if you said, well, I've got CPE training. What is that?
It's clinical pastoral education.
Okay.
That, and as Terry had mentioned, it's either 3 months or a total of 400 hours in which you're working in a hospital setting, usually a hospital setting, not always
Doesn't always
an
have to be there.
institutional
Could be
setting.
institutional setting.
But you have a supervisor who is supervising what you do, and you have to do what's referred to as verbatims, at least I did, verbatims, and in which you share with them, this is how my visit went, and this is a seasoned veteran chaplain, for lack of a better term, who will ask questions. Well, Steve, why did you ask that? Or that was a good thought,
Okay.
The other part of that is that there's ongoing education as a part of that, and so there are significant numbers of hours that are spent trying to understand the dynamics of the particular ministry situation that you're in, if it's a hospital clinical setting, if it's a juvenile setting, if it's a jail ministry, if it's there are so many different places where chaplaincy can take place. We have chaplains in airports, believe it or not. There's a trucking ministry that has a chaplaincy program.
We've got one down in a casino down here.
Yeah, they all need to be used.
But I wouldn't bet on it. Well,
Well, that was good. That was good.
Maybe it's the last resort.
We're really spiraling fast downhill. Mark, question with regards to confidentiality. So that's been mentioned, but give me some perspective, or give us some perspective with regards to chaplaincy and what you hear from a patient or family member, and how that, the confidentiality of that, or can you just kind of expound
Yeah,
on
well, you know, of course, I mean, confidentiality is so important to us because that's where the trust is going to come from, you know, with the patients and family and whomever we speak to. And beyond that, you know, there are laws that cover that with HIPAA and so on. And we want to be, you know, very careful with that because whatever information we learn we want to be helpful to them. We want to make a connection, a compassionate connection. And if we can't build that kind of trust, then we lose, you know, really what we have with them. And so, you know, I think we assure them that's, you know, this is really between you and us. And then there's that delicate balance, of course, between learning what their need is and so on, and you know, the staff interrelationship there as well.
And the confidentiality I find in especially our smaller communities where everyone knows us and so forth, that I sometimes run into a friend of someone who is hospitalized. But confidentiality to me means I can't even acknowledge that I saw the person,
Right.
or that the person is even hospitalized.
Yep.
Right.
To me, that's so important. If they bring it up, that's fine. But
Or
I'm
if
not
they
about
want their pastor or priest to know, obviously we would do that.
Right.
And, but it has to be with their permission. And, there is a distinction between confidentiality and privacy. And confidentiality has a lot of overtones of secrecy in contact. And we are part of the staff setting to the extent that we are part of the ministry, the program of healing of the hospital. And so we do and can chart a visit with an individual. If we believe that there is some emotional issue that is impacting the healing process, without necessarily giving all the details, we can at least alert the staff or bring in individuals that might be able to assist with that by recommendation. Beyond that, we have exactly the same confidentiality as we would have any pastor or priest would have with an individual that's a member of their congregation. And there are some very specific state laws related to that as well.
Good. We are just about out of time, which it always goes by so quickly. It's been great to be able to visit, talk about chaplaincy, and I know, just speaking on behalf of Fairview Range Medical Center, we're just so grateful to our volunteer chaplains, to each of you individually, and you each bring some very special skills and talents to helping us providing health care to our patients. So we're very grateful to each of you for what you do, and hoping you will continue that. So thank you for joining me today. I hopefully those watching have learned a little bit more about hospital chaplaincy, and maybe the next time if they're in that setting, they might consider talking with a hospital chaplain, and I know it can be a great blessing. And so again, thank you to each of you for your time today. So that's all our time today. Thank you for watching. I hope you enjoyed and learned a little bit more about hospital chaplaincy. So thanks for watching, and watch next month for another segment of Fairview Range Focus.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.